First, I want to introduce Michael Albert, who's our sign language interpreter. Thank you, Michael, for joining us. I'm pleased to be here today to announce Cook County's investment in a contact tracing program as we begin to recover from the COVID-19 pandemic. First, I'd like to acknowledge those who've joined me today, our senior leaders in the Department of Public Health, Dr. Rachel Rubin and Dr. Kiran Joshi. I'm proud to announce the Cook County Department of Public Health will invest $40 million in COVID-19 relief funding into the contact tracing program. This investment will allow us to trace more than 3,000 new contacts each day. For Cook County to reopen, it is critical that we quickly ramp up our contact tracing capabilities. The program will help us continue to mitigate the pandemic by identifying new cases quickly and helping residents who've been exposed to someone carrying the disease. While we've made tremendous progress, the pandemic is far from over. We know that we are months, if not a year or more, away from a COVID-19 vaccine. As we move forward, it's crucial that individuals who are exposed to the disease are notified so they can isolate themselves, seek medical care if they need it, and prevent further spread of the virus. Contact tracing is an important milestone in our recovery efforts. Since the beginning of the COVID-19 pandemic, we've pursued an equity-centered approach. Our contact tracing program will be no different. We are committed to serving communities that have been disproportionately impacted by the COVID-19 pandemic and who have experienced systemic racism. We will hire from those zip codes. In our COVID-19 response, we've prioritized equity and access. We know that there's a significant language barrier for many of our patients. The contact tracing program will be bilingual to ensure that more than 1 million Spanish-speaking residents will be served. The program will have a robust community mobilization component, including a marketing campaign to ensure that residents are aware of the important information and what to do if they are contacted. I'm deeply grateful to our Department of Public Health and encouraged by all the progress we've made. Now, I'd like to turn it over to Dr. Rubin.
Thank you, President Preckwinkle. So first, a bit of a situation report. I'm glad to say that the number of new cases and newly reported deaths from COVID-19 are decreasing. The positivity rate, which means the number of new cases we're seeing each day divided by the number of tests that have been done, has decreased to a 9% average over the last 7 days in the Northeast Illinois region, which is a tremendous decline over the last months, which indicates our physical distancing and other precautions have done their job. And this bodes well for suburban Cook County as of now. We have not yet seen a surge of cases from the recent move into phase 3 of the Illinois opening and also as a consequence of the demonstrations, but we are watching for any mini surges that may occur over the next few days or weeks. So what is contact tracing and why is it important? Case investigation and contact tracing is the process of questioning a newly diagnosed case of a disease, in this case COVID-19, and determining their close contacts at home and work and other places they spent significant time from 2 days prior to becoming symptomatic or testing positive if you've been asymptomatic. The contacts are then interviewed and advised on quarantine for 14 days since their last exposure. And all information is kept strictly confidential and only entered into the state disease surveillance database. No information is released to any other entity. Contact tracing is extremely important to mitigate the next surge or outbreak of disease. The only way to stop the spread of disease is to have cases isolate until they have recovered, but for a minimum of 10 days, and contacts to quarantine for 14 days, as long as they don't develop symptoms. And our plan consists of 5 components. The first is our case investigation and contact tracing activities. So we're ramping up from about 25 of our current staff who are doing contact tracing to a staff of about 400 individuals for the entire program. To do the actual tracing, monitoring for symptom development, and to identify needs for wraparound services such as alternative housing or food resources as the additional components of this program. Our second part is epidemiology, which will manage statistics to understand trends and identifying hotspots amongst other modeling issues. The third component is evaluation, where we will be measuring the effectiveness of our efforts and monitoring our productivity and trying to do things as efficiently and as carefully as possible. The fourth component is grants management, so we can be accountable to show how money was spent and what our outcomes have been to date. And we will have quarterly reports to the state, which will also be distributed. Also, our final component is community mobilization. Community-based organizations and our care coordination teams will provide wraparound services and resources. So the CBOs, these community-based organizations, will be engaged via an RFA process for community outreach and education, enhanced care coordination, and workplace issue identification amongst other community issues. So that's the basic plan, and now I'm going to turn over the podium to my colleague and co-partner at the Department of Public Health, Dr. Kiran Joshi.
Thank you, Dr. Rubin, Madam President, and all of you. This grant is so important for those who have been most impacted by COVID-19. Consistent with national trends, our data have been showing that the rates in our south and west suburbs are higher than, and that COVID-19 is impacting our African-American residents at a rate of about 3 times higher than their white counterparts, and our Latinx residents are being impacted at a rate almost 4 times higher than their white counterparts. We intend to hire suburban Cook County residents for these jobs who are culturally competent, multilingual, and have great communication skills. We'll prioritize applicants from areas that are most vulnerable and have been most impacted by COVID-19. Tracers, a little bit more about the program. Tracers will only be collecting demographic information and information about symptoms, and they will not be asking for financial information, and they will be trained to do all of this in a culturally competent manner. They will adhere to the strictest protocols for securing protected health information, and this information will only go to the Illinois Department of Public Health and will only be used to help us see where the disease is circulating so that we can allocate resources to where they are needed most. Again, this information will be used for the purposes of controlling the spread of COVID-19 only. We'll be expanding out our contact tracing workforce from 25 staff currently to 400 staff members over the next 3 to 6 months. We intend for the first cohort of contact tracers to be expected to be hired in early August, with the hiring process proceeding in waves of 50 to 100 until we're fully staffed in the fall. We've received a lot of interest in contact tracing positions. While we're not yet accepting applications, interested individuals may visit our website to express interest in applying to be a contact tracer right now. I want to be clear that this is not an application and that a separate application process will be announced and will be required. But we will certainly look at the individuals that have expressed interest. Again, for additional information, please check out our website at www.cookcountypublichealth.org, or feel free to call our hotline at 708-633-3319. All information will be made available in English and Spanish. Thank you.
All right, do we have questions? Rachel? No questions? Hal?
Yeah, it was pretty broken up on the line here, only got about half of it. This will be archived on the Facebook page? Or?
Yes, Nick says it'll be archived on the Facebook page. I'm sorry about the transmission difficulties.
Yeah, no, stuff happens, but
I think it's 400, is that right? 400. We'll hire them in waves. It won't be all at once, but we'll be starting hiring in August. Okay?
Okay.
I have a couple of questions, Madam President.
Okay, good. I'm sorry, I called you first, but,
Grateful for this time.
yeah, no, I called you first, Rachel, but you must have been on
Oh,
mute.
sorry,
Go-
couldn't hear you.
Go ahead.
Can you explain beyond just hiring people from communities why this is so important to communities that have been heavily affected and how you maybe see this stemming the impact of this virus in the Black and brown communities?
Sure. Dr. Rubin, so the question is, why is contact tracing so important to Black and brown communities?
As we're all aware now, we know that our Black and brown communities have been disproportionately affected by COVID-19, which means that we are seeing more cases and more deaths in those communities. And even though the rates are going down across the board, we are still seeing disproportionate effects in these communities. So the importance about contact tracing in these communities, as well as all others, but especially these communities, is that the only way that we can stop the spread of the virus is by identifying who is positive, and as soon as we know they are positive, excuse me, counsel them on the appropriate isolation. And if they are not able to isolate because they live in a home with many others and there isn't a place in their home for them to isolate, we have alternative housing to provide. And this is especially an issue in these underserved communities. And so we have the ability now to link individuals that are positive, as soon as we know they're positive, not only to help, not only to tell them they need to isolate, but to help them isolate. And then we will be identifying the contacts, meaning their other family members, maybe their coworkers, and asking them to quarantine, and again, being able to give them appropriate services so that they are able to quarantine for the 14-day period so that they will not spread the virus to others in their community. So it's especially important to do this in these communities, and it's not just the case identification and contact tracing, but it's also providing them the means to abide by isolation and quarantine.
And when will you start accepting applications for this?
Right now, through our webpage, there is a link to the State of Illinois interest form. So individuals can express interest in being a contact tracer through this online form. And that's one way that people can do that right now. But we will not be putting in place the actual hiring until later this summer, probably not until late July, with the intent of getting people on in early August. We are hiring management positions for this right now, but the actual on-the-ground contact tracers will be brought on later in the summer.
You also mentioned that you're looking for people who are culturally competent or who can go about this. Sorry, can you hear me?
Yes. So your question was about hiring culturally competent individuals?
Yeah, what does that mean? I guess, can you elaborate on that?
Sure, I'm going to have Dr. Joshi answer that.
Thanks for your question. So I think the principle here is really crucial, and that's that anyone making calls on behalf of the Department of Public Health to elicit information about a communicable disease has to be perceived as a trusted individual. And we think that hiring individuals from communities will be more able to establish that trust. And I think that trust is crucial if we're asking individuals in the community to share their health information.
Thank you.
All right, did you have any other questions, Rachel?
No, that's all for me. Thank you.
All right, Rahel?
I have one more question, if that's all right, and that is whether speed is of the essence here, considering that, you know, the state and city are both in phase 3 and people are getting out a bit more. Potential for a surge now. So how soon will this be completely up and running? I know you're doing some contact tracing
Okay, so the question is, what are we doing now? And if speed is of the essence, you know, how quickly are we going to be able to bring on, I guess, our fully staff up?
I would concur that speed is of the essence, but I would also argue that given the size of this kind of initiative, it's important to ensure that we're being thoughtful about how we establish the processes and operations and management structure. I think that is absolutely fundamental. Yes, we are contact tracing right now. Yes, it is very limited. We anticipate that if there is a surge, we do have plans to add additional staff that we could bring on right now to expand in a limited capacity. I do want to acknowledge, again, as we indicated earlier, that we don't expect to be fully staffed until the fall.